Antibodies versus antigens. Antibodies. Definition: proteins produced by the immune system to identify and neutralize foreign objects like bacteria and viruses. Origin: naturally produced by the body's immune system in response to antigens. Function: each antibody is specific to a particular antigen, binding to it to help the immune system target and eliminate the threat. Antigens. Definition: substances that the immune system recognizes as foreign or dangerous, triggering an immune response. Origin can be parts of pathogens like bacteria, viruses, or other foreign substances entering the body. Function: stimulate the production of antibodies. Presence in the body: antibodies, naturally present in the body. They are produced by B cells, a type of white blood cell, as part of the immune response. Antigens, not naturally present. They are external substances that enter the body and trigger the immune system. Discussion in an urgent care visit when discussed. Infections. If an infection is suspected, discussing antibodies can help determine if the body has mounted an immune response. Vaccinations. Vaccines introduce antigens in a harmless form to stimulate antibody production without causing disease. Allergies or autoimmune conditions. These involve abnormal immune responses where the body mistakenly identifies harmless substances or its own tissues as antigens. What it means and why. Current infection. Presence of specific antibodies can indicate a current or past infection, helping guide treatment. Immune status determines if vaccination has been effective or if there's immunity to a particular disease. Diagnosis helps diagnose conditions that involve the immune system, such as autoimmune diseases or allergies. Understanding antibodies and antigens is crucial in diagnosing and managing infections, determining immunity, and addressing immune-related conditions. When a doctor asks, "Does he have any antibodies?" they are typically looking to determine if the patient has been exposed to a specific pathogen or has immunity to a certain disease. Here's what they're looking for and why it's important. What the doctor is looking for. 1. Evidence of past infection. Specific antibodies. The presence of antibodies specific to a pathogen can indicate a past infection, even if the person was asymptomatic. Immunity status. Vaccination response. After vaccination, the presence of antibodies suggests the vaccine successfully triggered an immune response, providing protection against the disease. 3. Current or recent infection. Acute infection. Certain antibodies, like IgM, can indicate a recent or ongoing infection. 4. Autoimmune conditions. Autoantibodies. In autoimmune diseases, the body produces antibodies against its own tissues, which can be detected through tests. Why it's important. Diagnosis helps confirm or rule out infections, aiding in diagnosis and treatment planning. Treatment decisions. Guides decisions on treatment, such as whether antibiotics or antiviral medications are needed. Public health. Understanding immunity levels in individuals can inform vaccine recommendations and outbreak management. Monitoring. In chronic conditions, monitoring antibody levels can help assess disease activity or response to treatment. Overall, detecting antibodies provides valuable information about a person's immune status and helps tailor medical care to their needs. Common antibodies, also known as immunoglobulins, Ig, play various roles in the immune response. Here are a few. 1. IgG, immunoglobulin G. Function: the most abundant type, crucial for long-term immunity and memory. It provides the majority of antibody-based immunity against pathogens. Characteristics: can cross the placenta, providing newborns with passive immunity. 2. IgA, immunoglobulin A. Function: found in mucous membranes, saliva, tears, and breast milk. It protects body surfaces exposed to foreign substances. Characteristics: plays a key role in mucosal immunity. 3. IgM, immunoglobulin M. Function: the first antibody produced in response to an infection. It is effective in forming complexes with antigens and activating complement. Characteristics: indicates a recent or current infection due to its early presence. 4. IgE, immunoglobulin E. Function: involved in allergic reactions and defense against parasitic infections. Characteristics: triggers histamine release from mast cells and basophils, contributing to allergy symptoms. 5. IgD, immunoglobulin D, function, present in small amounts in the blood, with a role not as well understood as other antibodies. It is involved in the initiation of immune responses. Characteristics, found on the surface of B cells, helping with their activation and function. Each type of antibody has a specific role in the immune system, contributing to the body's ability to. When a doctor asks, "Do you have any antibodies?" they are usually inquiring about specific antibodies related to a particular condition or vaccine. Here are some examples of how someone might respond. 1. Post-vaccination. Yes, I have antibodies for measles, mumps, and rubella from my MMR vaccine. I was vaccinated for COVID-19, so I should have antibodies for that. 2. Post-infection. I had chickenpox as a child, so I have antibodies against the virus. I recently recovered from the flu, so I should have antibodies for that strain. 3. Autoimmune screening. I was tested for rheumatoid arthritis, and they found rheumatoid factor antibodies. I have antibodies related to lupus. 4. General response. I'm not sure, I haven't been tested recently. I had some blood work done last year, but I'm not certain what it showed regarding antibodies. These responses could vary based on the individual's medical history, recent vaccinations, or infections. To determine what antibodies someone has, several approaches can be used. 1. Blood tests, serology tests. These tests measure the presence of specific antibodies in the blood, indicating exposure to certain infections or vaccines. Titer tests. These assess the concentration of specific antibodies to determine immunity levels or prior exposure to diseases. 2. Medical history, vaccination records. Reviewing records can provide information on expected antibodies based on vaccines received. Infection history. Knowing past infections can suggest the presence of corresponding antibodies. 3. Laboratory panels, autoimmune panels. These tests look for autoantibodies related to autoimmune conditions. Allergy tests measure specific IgE antibodies in response to allergens. Consultation with healthcare provider, discussing symptoms, medical history, and potential exposures can guide which antibody tests